Well, I'd like to welcome everyone today. My name is Portia Reddick White. I am the VP for Strategic Partnerships at the Tobacco Free Kids. And I am enjoying welcoming you to today's Ending the Youth E-Cigarette Epidemic and Reducing Youth Tobacco Use, What Principals Need to Know. So thank you for joining us. Additionally, with us today, we have Dr. Shauna Spickert from Milan Middle School principal, who is principal there in Milan, Michigan. She's got 15 years of middle level principal experience and 23 years total in education. And Shauna is past president of Michigan Elementary and Middle School Principals Association, as well as NAESP state rep. Additionally, I am joined by Caroline Goncalves Jones, who is the Director of Advocacy and Outreach for the Campaign for Tobacco-Free Kids. So today we welcome your questions as we move forward. Please go ahead and place them in the chat. But before we get started on the presentation itself, I think we're going to do a quick little poll here. I know due to the time we're not unable to get a plethora of folks on, but we still want to know from you some of these questions. So I'm going to go ahead and launch the poll. Question is, couple of questions here. Have you had problems with e-cigarette use in your school? Why do you think students are using e-cigarettes? Are you familiar with the health impacts of e-cigarettes? And really, what are you most looking forward to in learning today about within this webinar? So if you could answer that, that'd be great. Thanks. And while we're waiting still, again, I just want to thank you for participating and for your interest. You know, the e-cigarette epidemic is something that is a real big challenge within our schools, within our homes, with youth, young kids right now. And we just, we hope that the information and the evidence that we present to you today will be helpful for you to help combat this. So I think I've got almost everybody who's voted on the call at this point. You've got a minute, just a minute more to finish out if you haven't answered the polling questions. Okay. We are going to close that out. And as we end the polling, the question was, have you had problems with e-cigarette use in your school? And yes was one of those answers, of course, but then also we had the majority of you saying no. So why do you think students are using e-cigarettes? 100% agree on the fact that it's peer pressure. So we'll learn a bit more on that as well. And then, are you familiar with the health impacts of e-cigarettes? Everyone is familiar with that. And then what are you most looking forward to in learning in this webinar? What's driving the e-cigarette use, as well as resources to share with the community? So thank you for taking that poll. We're going to go forward now with our presentation, and I'm going to pass it to Caroline Goncalves Jones. Caroline, take it away.
Thanks so much, Portia, and thank you all for joining today. We know there's a lot going on, and we appreciate your time, especially in such a crazy time. As Portia said, please put your questions in the chat, and we'll get to them at the end. But please feel free to as you have them, put them in there. We at Tobacco Free Kids have been very focused on the youth e-cigarette epidemic for the past couple of years, and over the past year have had a partnership with NAESP, which has been really fantastic, and having you all weigh in on these issues and weighing in and learning about and educating your communities about youth e-cigarette use and youth tobacco use. So we are an advocacy organization very focused on how do we get these products out of kids' hands and what are the best policy interventions to do that. So I'm going to go through a little bit about what the problem is, kind of what we know is driving the problem, which it seems like a number of you are interested in weighing in today, and then kind of what we at Tobacco Free Kids are doing to reverse the youth e-cigarette epidemic, as well as drive down youth tobacco use. So as I mentioned, we are in the midst of a public health crisis, which is a youth e-cigarette epidemic, which really started in 2018, primarily by the advent of Juul on the market, which I'm sure a number of you are familiar with. With Juul, that's kind of the most known e-cigarette. It's the biggest piece of the market share. So with in 2018 is kind of when we saw first surge of youth tobacco use, youth e-cigarette use. And at the time, the FDA commissioner called it just that, an epidemic. So what we are in is yeah, this public health crisis. So this is high school youth e-cigarette use, which you can see last year peaked out at 27.5%. 1 in 4 kids using high school students using e-cigarettes, which is absolutely unacceptable. And where we are now in this 19.6 number in 2020 is from data that was just released this past September. But as you can see, that's still at a level of when we first saw the epidemic in 2018. So we are in no way out of this public health crisis. We are still very much in it, with 1 in 5 high school students using these products. The CDC director has said that youth e-cigarette use remains an epidemic, and the current FDA commissioner has said youth use of e-cigarettes remains a public health crisis that is affecting children, families, schools, and communities. And I know you all are more focused on middle school and elementary school, and there really no good news there either. We still had last year, we had 10% of middle school users using e-cigarettes. We did cut that down a bit, but we are very concerned about, if we do not take the right steps, that number could continue to rise again. And what's more concerning is the growing concerns about youth addiction, and how often e-cigarette users are continuing to use these products. So more kids who use e-cigarettes are becoming addicted. 730,000 middle and high school students are vaping every single day. As you can see, there was just a steady increase, and this is among middle school students, about the amount of times, the frequency of use of e-cigarettes. And this is, more than 20% are using these products more than 20 days a month, which is a strong sign of addiction. We see the same thing in high schools, 20% in middle schools, 38.9% in high schools. So that's, the percentage of high school e-cigarette users reporting such frequent use has steadily increased, just like in middle school. So we know that this, even though we've heard more about it in high schools, we know this is not specific to high schools. We've seen plenty of reports anecdotally of use in elementary schools, in middle schools. This is a public health crisis that is affecting all levels of our schools. And the more we can educate our younger students, middle school and elementary school, earlier, the better, because there's a lot of misinformation out there about what is harmful. Are these products just water vapor? That's what we hear a lot of kids believe to start, that they're not as bad as cigarettes. And there's a lot of education that has to happen on the parent side as well, so that they know too and are aware of how early kids are using these products. It's just among schools specifically, we've found it very hard. We've heard principals, superintendents across the country have just been overwhelmed with this epidemic, and how do they deal with it? How do they protect their kids? So as I said, it's concerning that we're addicting a new generation of youth. We have made such strides to bring down youth tobacco use. Youth cigarette use is around 5% now, use is, across the country. And when we're at 20% of high school students using these products, that's just opening an entire new generation to nicotine addiction and to further tobacco use. So we are extremely concerned that we're going to cede all of the progress that we've made in the past 20 years to drive down youth tobacco use because of e-cigarettes. So we need to act now and get these products out of kids' hands. The amount of addiction is also incredible. As I said, we've seen increasing frequency of use among kids. And because of that, Kids are using these products constantly. We hear anecdotally of kids sleeping with their product underneath their pillow and getting a puff during the middle of the night, using them on the school bus, using them in the bathrooms, using them in the classroom. It's not like a cigarette where if you were sitting next to me, I would know you were using it. Kids are using these constantly all day. So it's the intensity of use is also of extreme concern. And so what is the impact on youth health? Because that is one of the biggest questions that we get is, isn't it better that kids are using these products than cigarettes? No is the answer. And that's a really important point. Nicotine is very harmful to the developing brain. The Surgeon General had said youth use of products containing nicotine in any form, including e-cigarettes, is unsafe, can cause addiction, and harm the developing adolescent brain. And as I said, nicotine is highly addictive. So it's a product that once you start, it's really hard to quit. And we don't want middle schoolers going down the path of using these products and be already becoming into a lifetime of nicotine addiction. Um, Youth and young adults who use e-cigarettes are more likely to use cigarettes, and they're also nicotine can prime the brain for future addiction to other drugs. So again, we don't want them going down this road at such a young age that's going to set them up for failure in the future. Um, as well as I mentioned Juul already, which I'm sure is a product a number of you are familiar with. The level of nicotine that is in these products is extremely concerning. One small Juul pod has the same amount of nicotine as an entire pack of cigarettes. And kids are running through these types of products in a day. So that the levels of nicotine that they're exposing themselves to is unprecedented. And as well, like, as I said, the health authorities continue to warn that e-cigarettes are not harmless. The Surgeon General, the National Academy of Sciences have all said that kids should not be using these products. And, in addition to the nicotine concerns, we don't know what's in these products. There's a lot of substances that we're not aware of because the FDA hasn't required e-cigarettes up to this point to disclose that information. So there's, kids could be inhaling harmful substances, including toxic chemicals and metals like nickel and lead. And those are not things that, young lungs should be breathing in. And talking about young lungs, there's a lot of concern as well about the links between COVID-19 and smoking and vaping. The CDC has said that now being a current or former cigarette smoker increases your risk of severe illness from COVID-19. What do we know about COVID-19? It is a disease that attacks the lungs. Smoking and vaping are activities that specifically use your lungs. So what do we know about smoking? We know that it increases the risk for respiratory infections, weakens the immune system, and is a major cause of a number of chronic health conditions. There's also a growing body of evidence that vaping can harm lung health. So we are cautioning at Tobacco Free Kids and as well at the CDC and at NIDA, all of these leading health groups are saying, if there was ever a time to quit, now is the time, because it's even more important to protect our kids and their health from COVID-19 and the risk of severe illness from COVID-19. Again, this is kind of some of the leading health experts have cautioned that there is no better time to quit than now, especially given the pandemic. And so we also wanted to caution, with schools reopening and kids coming back to school, there's a lot of questions to go along with COVID-19, as well as not only does it impact the lungs, we're afraid of transmission too with these products. We've heard of kids, using the same products in the bathroom, sharing a lot of these things. If you're smoking your e-cigarette, you're not wearing your mask. You're putting yourself at risk. And if you're putting your mouth on one product that 10 other kids have also put their mouth on, that's extremely concerning of moving the virus around. As kids return to school, we don't want principals and teachers to we want them to continue to caution about the health impacts of e-cigarettes and that this is not a public health crisis to forget just because we're in another public health crisis, because there are linkages between the two and we don't want one to impact the other. We don't know a lot about e-cigarette use over the pandemic. Those numbers I mentioned in the beginning of the presentation of 2020 youth e-cigarette use was from March, early March, just before a lot of schools closed and kids went home. But we do know that sales haven't really dropped off. So kids are probably still using these products at high levels at home too now. So as they return to school, we don't want them to fall back into the same things that they did when they were at school, whatever, 10 months ago, using these products in the classroom, in the bathroom, everywhere. We want them to hopefully practice smart social distancing and smart work, and not using these products at all, but as well as being very careful about them as we're moving forward. Tobacco-free kids, we have some great, if you want more information on COVID, the links between COVID-19 and smoking and e-cigarette use, we have some great resources on our website, and that's at tobaccofreekids.org/problem/COVID-19. You can just get it from our main webpage, but there's a lot more of this information too if you're looking for more of those types of resources to share with your community. Um, what we have said, and as I said, what leading health experts have said, there's no better time to quit than now, especially for our youth. And we do want to there's a number of resources that youth can use to help them quit, because we don't want them to be in this alone. So those are kind of things that at the bottom there that we've pointed youth to, of ways to help them quit using these products, because it is a very hard thing to do, to quit a nicotine addiction. We also have resources for parents if that's something that you as principals share with your community. From talking to kids, how to have these conversations, to what do parents need to know, to how do kids talk about these products. It's really helpful to hear kids talk about their addiction, and how they started using these products, not thinking thinking it was a cool thing to do, thinking they're flavored, they're fun, and very quickly fell into an addiction that they never expected. So it's really informative to kind of hear in their own words some youth speak about their nicotine addiction. So kind of also now getting to the problem. What's driving this problem? What do we know is, why are kids using these products? They know tobacco products are not good for them. Why do they continue to use them? And the reason that we know is because these products are flavored. They come in flavors that youth like. They're clearly designed to attract kids. And that is the reason why we know kids keep coming back to them and using them. So we've seen an explosion of flavored products over the past couple of years, and that's not just e-cigarettes. That's also flavored cigars, which come in many different flavors like cherry and banana smash, and are very cheap, 2 for 99 cents, as well as menthol cigarettes, which are the only flavored cigarette allowed on the market. And menthol cigarettes are used by more than 50% of youth smokers, and that's because they're easier to use. It goes down, the menthol makes the smoking easier. It's known as a starter product. So it gets kids started on cigarettes, and then they can move to more harmful, or as other cigarettes as well. But going back to e-cigarettes, there's more than 15,000 e-cigarette flavors, in flavors like cotton candy, cherry, watermelon, anything you can think of, unicorn, dew, all these different things. And I'm not joking about that. There's a ton of those different flavors out there that again are specifically geared to attract our kids to use these products. And this is not a new strategy. This is something that the tobacco industry has used for decades. They know that flavors are the way to bring in new replacement smokers that they need, because their current smokers are, smokers die earlier because of the health impacts of smoking. So they need to bring in new users. And they've had a hard time of doing that for a number of years, but they have found the solution with flavors. Is that's how they know they can continue to get kids to use these products. 81% of youth who have ever used a tobacco product initiated tobacco use with a flavored product, and 72% of current youth tobacco users used a flavored product in the past month. So we know this is what's bringing kids in to use these products, is the flavors. As I said, 7 out of 10 youth e-cigarette users said they use them because they come in flavors I like, and why wouldn't you if they come in flavors like, as you can see here, cotton candy, candy king, choco donuts, popcorn, all different flavors that are, again, not for adults. They're specifically directed towards kids. And here's some just anecdotes that we've heard from kids of why flavors are the reason kids use them. The reason Jewel spread so quickly was because it came in mango and fruit medley, and kids loved it. It tastes like gum. It's what brought kids in to use these products. And this is what the data tells us too. It's not just anecdotal. Most kids use flavored e-cigarettes. Among current youth e-cigarette users in 2020, 82.9% use flavored e-cigarettes. The most popular flavors were fruit, mint, menthol, and candy, desserts, or other sweets. And a big thing is menthol flavor. And the reason we've kind of seen a huge increase in the use of menthol flavor, 37% of all high school e-cigarette users used menthol products, is because it's the only flavor that Juul can now have on the market. Juul has its menthol flavor and its tobacco flavor. And as Juul removed its other flavors, menthol surged. And why is that? Because if a flavor is left on the market, kids will migrate to it. That's what we've seen time and time again, is as so long as a flavor is there, kids will find it and use that flavor. So in any kind of arguments, which the tobacco industry likes to use, is saying, we need menthol to help adult users. That's not true, because what we've seen is menthol flavors just attracting kids. And there's another thing that we definitely want principals to know about and be aware of is the concerning increase among disposable products. So disposable e-cigarettes look cool and fun. They're small and easy to hide, just like a Juul. You can see a number of them look like Juuls. I'm sure a lot of you are familiar with Puff Bar from the past year. That's a product that really surged. They're as cheap as $5, and some even have higher nicotine concentrations than Juul. But what's really concerning is over the past year, disposable youth use has surged. It increased by 1,000% among high school students and 400% among middle school students in the past year. Extremely concerning numbers. And again, these are the products that are now popular among our kids. So hard to find, just like a Juul. And these are ones that, instead of keeping it and there's kind of the evidence left over for a principal or a parent to find, you just throw these out once you're done with their use. So it kind of even leaves folks, the adults in the room, less able to find out the products that kids are using. And the refillable devices as well are still incredibly popular too. Smoke and Soren are the two most popular devices, right behind Juul. And these devices are ones that you can put in all those 15,000 flavors into. So that's exactly what kids are doing. And there's also concerns about how kids hide these products. I'm sure a number of you in your schools, or maybe have heard in your other schools and some of the high schools, how these products are disguised to specifically elude teachers, parents, principals. They look like highlighters. They look like flash drives. They can be in your hoodie. They look like a phone. They look like a lipstick. These are all things that the industry is specifically trying to get kids ways to use these products under the noses of the adults in their lives. So I also wanted to briefly touch on as well the other flavored tobacco products that are out there that we know are concerning and that we know kids are using. As I mentioned, there's over 250 cigar flavors in lots of different ways, and they're 2 for 99 cents, which is really helpful for price sensitive youth who can afford them. And the cigar companies know exactly what they're doing in marketing to youth, going on platforms that they know that they use, like TikTok and Instagram, using influencers that they care about to promote these products. And then it's no surprise that cigars surpass cigarettes in popularity. More kids are using cigars, 7.6% to 5.8%. And African American youth have the highest rate of cigar use, as you can see. So there's also a disparities issue there that we are really looking to address. And then I also mentioned menthol cigarettes, which again is the only flavored cigarette on the market. More than 50% of youth smokers smoke menthols, and 85% of African American smokers who use menthol cigarettes. And that is because there has been decades of tobacco industry targeting of the African American community through sampling and mobile van programs, music and event sponsorships, and targeted magazine advertising, which you can see some of the examples of here. So it's really a disgusting campaign that's gone on for decades that they're now trying to do, again, find their replacement smokers in our kids and using the flavors in the same way. So kind of what are the next steps? What do we need to do? From our perspective is we need to prohibit all flavored tobacco products. That is the work that we at the campaign are doing, that we've involved NAESP in, who have been fantastically supportive of, and who we'd love to involve you all as advocates in if you'd be interested in engaging with some of our campaigns. So how do we do that? The FDA could act tomorrow to prohibit flavored products and take them off the market. Um, Congress could act to prohibit flavored products through legislation, and states and localities can also pass legislation to do that and prohibit these products. So you may have heard last year, September of last year in 2019, you may have heard somewhere in the news that the administration had planned on bringing flavored e-cigarettes off the market, which would have been a fantastic thing. Unfortunately, at the end of the day, the policy that they finalized was a lot less rigorous than that and really only took pod-based products off the market that were not menthol. And as we mentioned already, menthol is a huge driver of youth use. So it really was an ineffective policy when there was a great opportunity to get something done. So what was left on the market was all these things that we've already discussed. All of these products are still out there, still being used by our kids, and are the most used products by our kids. So it's incredibly important that we continue to act and go further to reduce youth tobacco use, youth e-cigarette use. And through that is we believe Congress should act, and we also believe states and cities should act. This past year, we did pass a bill out of the House of Representatives that would prohibit all flavored tobacco products. While it hasn't gotten to the Senate this year, and we don't expect it to, it's something that we're going to look at again next year, and we would love engagement from you all if you're interested. NAESP was very supportive of the bill. And we would love to engage folks in that type of work next year in promoting and the importance of prohibiting all flavored tobacco products. This bill would also ban online sales of tobacco products and raise a tax on e-cigarettes as well. We've also been working in the states and localities to try to prohibit these products and go a little bit more piecemeal as well to push the federal government. Last year, November of last year, Massachusetts became the first state to prohibit all flavored tobacco products. And then earlier this year, New York and New Jersey were two of the states that prohibited flavored e-cigarettes. This past August, California prohibited menthol cigarettes, flavored e-cigarettes, and flavored cigars, which is an incredible step forward and put us at 25% of the population being covered by places that have enacted restrictions on the sale of flavored e-cigarettes. Unfortunately, the tobacco industry is challenging that law, but we'll fight it to keep it intact as much as we can. And so we have Protect Kids, Fight Flavored E-Cigarettes, which is an initiative to reduce youth tobacco use that we'd invite you all to engage in, and that's fightflavoredecigs.org. And we're trying to bring communities together, voices together to speak out against the impacts of flavored tobacco products. And as I said, we have campaigns across the country to do so. So those campaigns in states in Massachusetts, New Jersey, New York, California, those were all campaigns that we had a part in running in trying to get the legislatures to take action on this issue. And we'll have a number more next year that we'd love to engage you all in. And there's also a communications component to our campaign too, and where we're trying to get folks to learn a little bit more about the products, specifically from the voices of youth and who are using them, and get that word out through spokespeople, through youth advocates, and everything. So here's one example of
You can't stop using an e-cigarette just like that. E-cigarettes were like nothing I'd ever seen before. They were colored, they were flavored. The fruity flavors, the mints, the candy, gummy bear, I 100% believe they were targeted towards teens. Do find your child using e-cigarettes, try to be understanding and help them to quit.
So we're also doing campaigns like that, communications type campaigns to educate and inform folks about the dangers and what's going on. Oops, sorry, just got to get the slide to move. So again, here's how you can join us in our campaigns and get some more information about our work and what we're doing. And we'll share this information as well with folks. But we have, our national campaign is Fight Flavored E-Cigs. And if you sign up there, you can get information about all of our local campaigns as well as federal campaigns. We also have a National Day of Action, which is Take Down Tobacco, which we'd love your schools to engage in. And most importantly is we want to be a resource for you all as you have those discussions in your schools about how the health impacts and why kids should not be using these products. So with that, I would actually love to turn it over to Shauna to talk a little bit about her experience in her school and kind of what she's done to address this issue in her school. And we really wanted to have the perspective of a middle school principal on this as so you all can relate and kind of hear about some of the activities that are being done that could potentially inform and help you all in your work. So Shauna, please take it away.
Thank you. So what we are seeing, so we're close to Ann Arbor, Michigan, here in Milan, and the biggest thing that we're seeing is that kids are getting the devices and the products from the house. So a lot of students are, when they bring it in, they're getting it from their parents. So it's really important through knowing that knowledge, communicating that knowledge, and education campaign has been really big in what we do. The other thing is that I chose peer pressure on the survey, but it's not necessarily like kids are pressuring one another as much as it is them wanting to be social and included. So at this early age, I don't think we're seeing the addiction nearly as much as we're seeing the experimentation and the social piece. So doing it with friends, it's never been just one person caught doing it. It's always been multiple people that are doing it. And so what we've really tried to do is make sure that we have reporting avenues, because probably over 90% of the cases that we have caught here at school have been reported by students. And that's because they've learned what the smell is. They've learned that it is social. So when they see two girls or two boys in a stall together, they know, and they smell something fruity. No longer are we seeing this as, it's probably bath and body products or things of that nature. Like, kids are suspicious and they're reporting those things. So we do have anonymous reporting forms that are available both electronically and that they can pick up in the office, which has been an extreme help. The other thing that we're seeing is just all the misconceptions that youth have, because they are flavored and they smell fruity. The kids aren't realizing that they're not okay. Parents are using it as a safe alternative to tobacco and cigarettes, which to them, that means that it's okay. Friends are telling them that it's okay. And because, it's so easy to hide, there are a lot of staff who had originally thought that it wasn't happening here because they didn't actually see it or smell it. So I'm in the dark. So what we've really tried to do here is to change that narrative. And we've done that through making sure in our 6th grade health and our 7th grade health curriculum, we've included curriculum on vaping and the dangers of vaping. So we use Catch My Breath as one of the curriculum pieces that we do. We use a lot of their posters and incorporate as much as that as we can to kind of let the students know that it is not safe, that you don't know what's in this. Why would you put something in your body when you don't know the chemicals that are involved in it and what the dangers are? And making sure that they understand that there are consequences for their actions. If you want to go to the next slide, I'll talk a little bit more about how we're handling what we're seeing. So we're really trying to fight back, like I said before, with that education component. So one of the biggest things that we did was really work to educate staff on what the devices look like, what they smelled like, how students were hiding them. And we have confiscated a lot of these devices. So actually taking them to a staff meeting and showing them what they look like. And you'd be surprised, you know, staff thought, oh, that was a perfume bottle, or that was whiteout tape, or that was a pencil lead box, or highlighter. So them being actually able to see the devices, how small they are, that's not a USB cartridge, was really, really helpful. In addition, our officer liaison put together a presentation that not only went to our teachers and our paraprofessionals, but also went to the bus drivers, custodial staff. So everybody was involved. And then we tweaked the presentation to also send it out to parents, which was really helpful. So the education component includes staff, families, the students, and then also having education on this is how you can report something if you do see it. The advocating is really, really important, you know, so whether you go to Capitol Hill or you just tweet your legislators and let them know how dangerous this is and give them stories. Like one of the things that we can do is to really make sure that we're communicating how this has affected our schools and how it's affecting our youth. When we're able to give them an example of what's going on in our schools, it can be that much more impactful with legislators. And the other piece is because, you know, I think especially the elementary and the middle level, it's not about just issuing consequences and suspending and expelling students. It's really educating them on what they're doing and helping equip them with the tools to make good decisions. So one of the things that we really try to do here, especially when it's the first time that students are caught, is we do in-school suspensions where they're having to do a report to talk about and learn about the dangers of what they're doing and some of the chemicals and products and the ingredients in those products, which has been really helpful because, you know, a lot of the times, like I said, it's social. They don't really realize they're doing some things. Not that deters all students, but it's really helpful. We've also made sure that we've included vaping within our handbook and our student code of conduct. So it's no longer just smoking or tobacco, but it's including all of these products. We've been very lucky that our school liaison officer will come over and talk to students about, you know, these things are illegal for them to have, that they're not of age. We've had a lot of students, because they're getting them from home, don't even realize that they have THC in them and are a drug and can get into a lot of trouble and expelled from school. You know, the second offense, you know, because it becomes a 10-day out of school suspension for students, that we do reduce that to a 5-day out of school suspension if they have proof of getting outside counseling or support, whether it's from, you know, their family doctor or a counselor. And last but not least, it's the referral to the board. And because we had some repeat offenders last year, and I'm not necessarily proud of this, but we had repeat offenders that was involving marijuana. We had 3 students who were actually expelled. So not just suspended, but expelled from school, which sent a very powerful message to the students that it's not okay to do this here. And it's really hard, you know, to take students to the school board to do that. But I do think that speaks to the students as far as, if anything, at least to scare them. If it's not from the substances that are in the product, the fear of being kicked out of school. So those are some things that we're seeing here. Obviously, under COVID, it's not been nearly as big of an issue, especially since we only allow 1 student in the bathroom at a time. But it was said at the beginning, like they're doing it on the bus, they're doing it in the restroom, and last year we even caught a student who was doing it in the classroom. So it's important that staff know how easy this is to do, and that they really understand what they look like. So I don't know if anyone has any questions, but that's some of the things that we've seen and some of the ways we're handling it.
Thank you, Shauna, so much. And I had one question is, how have you mentioned it a little bit, but the parent education piece from your end, I know is so important, because a lot of parents also don't realize kind of the impacts of these products. So can you talk a little bit about how you've kind of tried to bridge that gap at all?
Yeah, absolutely. So we use social media our parents are mostly on Facebook, some Instagram and Twitter. So we use some infographics that we get. So anytime we get some good infographics where we can share that, but we have actually sent out in our newsletters. For example, I said I tweaked the presentation that the liaison officer put together, so parents could see what the products are. So like I said, most of them are bringing them from the home, but there are friends, because it is social. So it's usually multiple kids that are getting in trouble. And so some parents will come in not knowing, where did they get this? I don't have this at home. I don't do this. So it's educating them on, what these devices look like, how students are getting them. I do find that the pictures and the presentation and sharing those links, as well as the infographics, tend to be a little bit more powerful than just written text. And videos. I mean, there are a lot of great videos to share, 2 or 3 minute videos on trying to help educate them on what's going on. We also, when a student does get suspended, the assistant principal did put together a really nice resource page on these are different ways that you can seek outside support to reduce the suspension for your child. So we've spent some time researching area, supports in the area to help kids specifically about this issue.
Fantastic. Thank you. If there are any other questions, here are a couple of the links to resources that we had, and I know Shauna put some in the chat as well, so thank you so much for that. But definitely want to hear if there's any other questions folks might have about anything or any of the work that we're doing, and how you might be able to engage in it. If there are none, we can go ahead and wrap up. Portia, did you have any questions or thoughts to share?
My thoughts really are just the fact that, first of all, thank you, Shauna, for being really so explicit and expressing from your point of view things, tangible things that we can take back and learn. So thank you for that. I just want to share my gratitude for those who are able to view this, and we'll ask you to reach into us for more information. We are there to support, to help, and we really look forward to being a good resource with you and for you. So with that, I think that's it, and we thank you for joining us today.
Thank you all, and we've recorded this so folks can watch on the back end as well. So thank you so much.
Right. Thank you. Bye-bye.